You ready? Okay.
I'm ready.
All right. KRVFM, the Heart and Soul of San Antonio. Dr. Doug, we're here with you. And as promised, our Saturday conversation today is with Mayor Ron Nirenberg. Hey, Ron, how are you?
Hey, Doug, good to join you.
Thank you
Thanks for
so
having me.
much for taking time out of your extremely busy schedule. I know you got a lot of stuff going on. So, no further ado, let's just kind of get after it. Um, so first I want to ask you about is kids are going back to school and everything, and we've got the thing that the CDC says they should be wearing masks and so tell us a little bit about that.
Well, we know that the vaccines, which are readily available, and people need to go get vaccinated. We've got access points all over the place. They're safe, they're effective, they're free. It doesn't require insurance, so just show up. We need everyone to get vaccinated. The vaccines themselves will prevent severe illness and death, even from this Delta variant that we're seeing surge across this community and across the country. It does not eliminate transmission, though. And so we've seen a great acceleration of the COVID 19 infections across our city over the last month or so and across the country. So much so that our hospital capacity, our medical capacity, has already been stretched past its limit. You couple that with the fact that we have thousands, tens of thousands of young people going back to school, many of them under 12 years old. And again, anyone under 12 is not even eligible to receive the vaccine. We are in a very difficult spot. So the guidance from the CDC is, number one, if you're eligible to be vaccinated, go get one immediately. And two, if you're not, or if you're going back to school, you need to be wearing a mask. In a school environment where we have, again, thousands of children, many of whom are unvaccinated, and we also have people in close quarters all day long, you need to be wearing a mask. And so we have put in a mask mandate according to the Public Health Authority's directive and her authority, which is now, again, following the guidance of the CDC in recommendations to keep the public and the community safe, particularly in schools.
So I heard even I don't remember the exact day, it was either Thursday or Friday, that for about 3 or 4 hours we had no ambulance capacity, or we were out of emergency response units because of all the things that are going on. The normal things plus the variant.
That's right. You know, this Delta variant has again caused so many infections so quickly and so severely across our community that we've seen now 10 times the number of hospital patients than we had at the beginning of July at the moment.
Wow.
And they're filling up the ICUs. We're just about at our limit of ICU capacity. Our hospital beds are nearly at the highest point they've ever been during this entire pandemic. And throughout this week, we've seen more emergency transports, emergency calls to 911 for COVID 19 related illness. We've seen more this week than we have ever seen during the entire pandemic. They've caused so much stress on our hospital system, along with the fact that, you know, EMS units are running daily for a lot of other things, including car accidents, trauma, slips and falls, heart attacks. They're having to do all that stuff. So when you couple it together, that with the COVID 19 surge, we ran out of capacity. And that's why it's incredibly important for people to use the tools that are available here at the local level to protect themselves from the COVID 19, namely mask wearing and vaccination. And that will help us not only protect your life and those around you, it'll also help to ease the overstretched burden of the medical system, which, whether it's COVID 19 or not, your life will one day be in the hands of healthcare. And you want that, you want those resources available. And so we've got to do our part. Every one of us has to do our part to make sure that it is.
So now, thank you for that. Now, what about the you and the judge were on the other day. You were talking about the Freeman Coliseum and the Regeneron.
Yeah.
Can you tell us a little
Yeah.
bit about that?
Sure, yeah. So we have been asking for this to be set up to have the state release that contract so that we can what that is. They finally did it last week, and basically what that is there is a antibody blood infusion that can be done for COVID patients who have moderate to mild illness that are on the verge of hospitalization. If they get this infusion at the right time, it has to be ordered by a doctor. If they get the infusion, it will, in many cases, prevent that person from having a hospitalized illness. So it keeps them out of the hospital and therefore also keeps that extra burden away from the hospitals for the most serious cases. It has to be ordered by the doctor. If the doctor prescribes it, it will be done at screening. It will be done at no cost, no charge, but it does have to be done through a doctor's prescription. And the type of antibody treatment, or excuse me, it's a monoclonal antibody treatment that is essentially an infusion therapy, and it is called Regeneron is the name of the infusion.
Yeah, I had someone really close to me have that, and it really worked well. So I was glad to see that as an alternative as well, because that should help alleviate a little bit of the stress on the emergency rooms.
Yeah.
So
It's critically important that we use all the tools at our disposal now. Again, the most important ones being vaccination and mask wearing, but also these other therapies for those who do find themselves ill. If we can avoid a more severe illness through infusion therapy, keep them out of the hospital, help them get better faster, that's something we ought to be doing as well.
so a lot of people thought we were done with the, and actually even when the Delta variant first came out, that we were done, because the vaccine is up. And oh, by the way, I don't know how many people know this, but kudos to you and the judge and healthcare professionals, because if I understand it correctly, correct me if I'm wrong, we had the President Biden's C or COVID director come to San Antonio, and he gave you guys quite a pat on the back for your efforts.
Yes, Dr. Shukhair, who is the White House vaccination coordinator, did come to San Antonio and recognize our efforts as a community to get folks vaccinated, particularly in San Antonio where there are very hard to reach populations. We've done a good job. The trouble is, again, there are thousands of people who are not eligible for the vaccine, those who are 12 and younger, and so we've got to protect them. We also have, 30% or so of the other folks who, for whatever reason, are not getting vaccinated, whether it's outright refusal or not having access. So we've got to reach those folks. And honestly, Doug, we thought we were. We had to keep our eyes open. We had to make sure we stayed vigilant and alert. But most people, myself included, thought the worst was over. The trouble is all the carnage that we've seen now is preventable. And if folks would have just gotten vaccinated, and if folks get vaccinated now, we can shorten this misery that we've all been feeling. And in the meantime, to slow down the transmission and ease the burden on the hospitals, we got to start wearing masks. If people would do the simple things to control this pandemic, we can put this behind us. But this has become so politicized, and for no good reason, people are just leaving this to chance and risking a lot the health and safety of themselves, their loved ones, and our entire community. We've got to turn that around and get folks vaccinated. And we also, quite frankly, have to call it out when we see it, the politicization. It's also why we've taken the governor to court in terms of his abuse of emergency powers to prevent us here at the local level from managing the emergency, which we are statutorily obligated and responsible to do. He has tied the hands of public health authorities and local officials from dealing with this emergency. And so that's what the court battle is all about as well, which continues to play out.
What's really interesting for a guy, our governor, for a guy who doesn't want any type of overreach, government overreach, how he's trying to use his power to provide government overreach over what our local officials do here. It seems very contradictory.
It's tragically ironic that he would using emergency powers and now asking for an emergency ruling from the Supreme Court. He would use his emergency powers to prevent us at the local level from dealing with the actual emergency. It's just the worst of absurd. absurdities, and our children, our community, our lives, are collateral damage to the political games that they're playing.
Well, like I said, you and the judge have done an outstanding job. And so I really, I'm glad I live in San Antonio and not some other places. And you guys just keep up your good work. I got one more thing, and I'm gonna let you go because I know you're really busy. The evacuation moratorium. Can you tell us a little bit about that? And it's supposed to end on the
Sure.
third, but let's talk a little bit about that for a second.
Yeah, I think you're talking about the eviction moratorium that CDC put in place, and
Yes,
there's
sir.
going to be some legal challenges to that as well. We've had for the better part of this pandemic an eviction moratorium whereby landlords, property owners were you know prevented from filing eviction proceedings. Here it doesn't prevent all of it. It's supposed to be uh, any filings that are put in are supposed to be non-COVID related. Of course, we've seen some evictions happen across the country. Here in San Antonio, we have taken a more cautious approach, and we didn't want to rely on these kinds of moratoriums alone to provide a safety net for our community. So while the eviction moratoriums have been helpful, we've had an emergency housing assistance program in place in which we've been working with property owners and landlords and tenants all at the same time to prevent people from being evicted. So essentially, if you've lost income, lost a job, and are unable to pay your rent because of the pandemic, we have a housing assistance program that is one of the largest of its kind in the nation that will help with that. And so all you have to do is call 311. A housing navigator will get on the phone, talk with you through the situation, and try to get you enrolled in that assistance program. We have kept it funded throughout the duration of this pandemic. We have added to the funds as necessary to make sure that those funds don't run out. We have done that again, and at this point, we have enough resources in the emergency housing assistance program to last us through the end of the year, and we'll continue to calibrate that as necessary to make sure that we live up to the promise that no one loses their homes, no one loses the roof over their head because of this pandemic. We've got to make sure that the folks that have been laid off, that have lost income because of the pandemic, have resources available to make it through.
And now I just want to be clear for everybody who's listening, because we have the emergency housing assistance that is over and above the CDC moratorium, correct?
That's right. That's right. And the purpose for that is to make sure that it's one thing to have no filings happening, but the challenge with that is that at some point bills come due, and we want
Right.
to make sure that bills are being paid through the assistance program so that there's not a big invoice for a family or for a community at the end of the day. That's what our focus has been, and we think that it's been a solid approach. It's been recognized by housing advocates in the state and across the country as one of the best programs to come out of the pandemic.
Well, Ron, you and the council have done a fantastic job. Thank you for everything that you guys do. And the thing that makes you guys, no matter what the challenge is, you always have a multi-tiered approach to try to give people options and things. And really appreciate that. And I know the rest of the citizens out here too. I know you're extremely busy, so we're going to cut it short. Thanks so much for the update. You go and take care of yourself most of all, because without you, we'd really be in trouble.
Well, I appreciate it, Doug. I always enjoy coming on, and to all of your listeners, just know that we are working together as a community, and we're doing these things because we love each other. We stick together. We're going to make it through together. In the meantime, I'm a firm believer that God helps those who help themselves. We have the tools at our disposal to put this pandemic behind us and protect our loved ones. So mask up, get vaccinated, and make sure that you watch out for those who need that advice as well.
Mayor Ron Nirenberg, thank you so much, Ron. I really appreciate you. Go back to doing what you're doing. I know you got stuff to do. Thank you for taking time out for us.
Thanks, Doug. Talk to you
I'll
soon.
talk to you soon. As Mayor Ron Nirenberg, he is quite the guy. You know, if no matter what you look at it, you look at the homeless thing, you look at the pandemic, you look at just the different difficult things. He's had a very difficult couple of years here, but you know he has stood fast up against the political will of our state government, and he has really looked out for the people here in San Antonio. So we're very fortunate to have a man of his caliber. And like I said, you know, with all of these things, like with the pandemic, with the Delta variant, you know, he's got the Regeneron things for people who are sick but not really, you know, critically ill. He's got, I mean, he's always has a multi-tiered approach to every problem, and that's something that you know leaders all around, whether you're in private industry or public or whatever, you know, you got to have a multi-tiered approach to solving problems. And Mayor Ron and Judge Wolf, they both do that. So thanks to all of our city and county government, KRV FM, the heart and soul of San Antonio. This is the Dr. Doug speaks to the community. Dr. Doug Community Conversation, and we'll be back in just a few minutes.